patient's record software that is to transit healthcare from a primarily paper-based record-keeping system to electronics. This is the first to be developed locally in Uganda, and no internet is required to run it. So to explain that and how this particular software works and its benefits, so to speak, and what will trickle down to the health sector across the country and across the globe, hopefully, is Mr. Samuel Mugisha, the Director Innovations from Innovation Streams Limited. Thank you so much for making time, and welcome to Morning at 10 TV.
Thank you for having me.
I think this is some good news for the country. Moving from the usual paper-based kind of records to something that will cut across. You started from the Western region. It's amazing to see that now they're going to be using computers. Tell us more about this.
Yeah, good morning, viewers. I'm Samuel from Innovation Streams Limited. We partnered with an amazing hospital in Uganda, Chisizi Hospital. That's way back in 2013. And the idea was the mission was really to organize Uganda's healthcare data so that patients can access quality and affordable healthcare. So we've been on this mission, and we've developed an electronic health platform that clinicians can use to make sure, one, that they give quality healthcare. We are very, very strong on patient safety, no harm to the patient, while gaining all the other benefits of electronic records. Effective management, effective drugs management. You can access patient records whenever you want them, just through a click. Very fantastic, and very many other things that we've put in, like the community health insurance model of Chisizi, which is very, very exciting. So we've done this for the last 7 years. We've been in the labs for about 6 years, trying this, engaging with different stakeholders, and now we are bringing it to people. We are showing it to health workers and telling them to have a look and adopt it in their hospitals, because it's actually exciting.
So you're going to be having a conference, but we'll get to that later on. But tell us, you're saying that now you're opening it up to all the stakeholders and faculties in this particular sector of health. How will that happen? Should someone pay for this particular software? What will happen in terms of other sectors or other establishments pretty much borrowing this and having this in their institutions? What will that take?
Yeah, it takes a lot. Adopting electronic health records is really a whole change management process. Hospitals have to have computers. We've put up installment plans and help to make sure they get this infrastructure in place. Yes, they pay for our software. We have.
How much are we looking at?
We have a mixture of licensing and subscription model. So one can get a software for free and then pay 1,000 shillings per patient per year. You can get it for free and pay 1,000 per patient per year, or you can opt for a license where you get a lifetime license, and depending on the number of users in your hospital, it's really pretty much from Uganda shillings 3.5 million to about 30 million, depending on the size of the hospital. But that's a price that is really unbeatable. If you look at the cost of electronic health records in other countries like the United States, it's ridiculous. It's very, very huge, billions of dollars. So this is a cost that we think most health facilities can afford, and we are really very flexible, because really the goal is making sure that patients receive quality and affordable health care. That's the main goal. Is
the Ministry of Health ready to buy into this, especially knowing that you first worked with a rural hospital, and for other rural hospitals to embrace this, you're saying there's a cost factor to that, but is the Ministry of Health ready to foot this particular cost?
Absolutely. We've had talks with the Ministry of Health. The last one that I had was with the Director General of Ministry of Health, Dr. Mwebesa Henry, and they are looking at this. Of course, if it's massive number of hospitals, then the price goes down, and we are looking at all ways really of bringing this, even considering making it open source, as long as it gives the patients the quality and affordable health care that we all deserve.
All right, so before we get into the touch screen, so you can practically show us what's unique about this particular software and how it works, just give me pointers. We know different hospitals here in Kampala, them that can afford it, now no longer use files that go get a file, a hard copy file of patient XYZ. Most of them are on the e-platform. They do this in computers. They have softwares to do this. So what is the added advantage to this